Good morning, amazing participants to this extraordinary workshop. I am Professor Okoye, and I am part of the team that have put together this workshop that we believe will be very, very impactful in the life of all those who are undergoing the journey of cancer of the prostate, and their caregivers, and us who are part of the medical care team, joining in your journey, encouraging you, and ensuring that we give the best level of care that is needed to take you through the process of healing, recovery, and being available, as some of you have become, to share your stories. I am a radiologist, a professor of radiology. I've recently retired, but fortunately, I have just been appointed a professor emeritus of the University of Nigeria. And today is the press conference to announce this appointment as part of those who are going to receive this degree. As I was surprised when the letter said it's a degree award, and the convocation will be happening at Nsukka this Saturday. And I give God all the glory. I return all the glory to Him. So you're all very welcome, all the participants, and it's across board. We have healthcare providers of all categories, consultants, residents, all the other paramedicals, support staff, navigators, and the patients living with prostate cancer and their caregivers. All of us are gathered here this morning to support one another and to share our experiences, and also to engage in brainstorming that will enable us to do better with what we are currently doing. So in Nigeria, more than 72,000 deaths occur annually from cancer, with prostate cancer as the third leading cause of deaths, with a 12% incidence rate, and the third globally by incidence. Nigeria is third globally by incidence. And that's not surprising, because black men of African descent, are 60% more likely to have prostate cancer than their Caucasian counterparts. These figures have been said to be set to rise, and this is what has informed the effort to embark on this project that is called iCCaRES. I'll tell you more about it as we go on. And currently, we lack effective tracking due to a dearth of cancer registries in Nigeria. The American Cancer Society actually reports that this cancer affects approximately 7 black men, resulting 1 in 7 black men, resulting in 5,350 deaths among this demographic in the year 2013. Actually, the year 2019. Encouragingly, and I'm sure that all of us will be encouraged to hear this, that the mortality rates have been reduced by 50% since 1993. But the disparity in impact remains stark, with black men disproportionately affected compared to other racial or ethnic groups. This inequity extends globally irrespective of the birth country of those who are currently living with prostate cancer. So, tackling prostate cancer within the black community actually poses significant challenges due to various contributing factors. Overcoming this disease demands a concerted effort that involves pulling research, experiences, and resources from all stakeholders. Just a minute as we try to readjust ourselves for this presentation. It therefore appears that we need to look critically at the research, the experiences, and resources from all stakeholders who are either involved in this mission of engagement in this ecosystem. This need has informed the establishment of what is called iCCaRES, and it stands for Inclusive Cancer Care Research and Equity for Black Men Consortium. And it comprises prostate cancer survivors, which some of us like to call persons living with prostate cancer, advocates, those of us who are passionately desirous to find a cure and a way to contain this disease, researchers, and healthcare providers. The objectives of the iCCaRES for Black Men Consortium is to fight prostate cancer in the Black community all over the world by the following strategies. Number one, conducting research that will let us understand issues that affect the health outcomes of prostate cancer patients. These factors could be what we are born with, genetics, or factors that have to do with where we are born, where we live, work, or play. I think I'll need a book support to lift it a bit. Thank you very much. Pardon me for all the adjustments, eye level, and all that. So, as I said, these factors could be what we are born with, which is the genetics, or factors that have to do with where we are born, where we live, and where we work or play. The second one is to develop programs that will help Black men to better cope with prostate cancer diagnosis. In fact, one of our prostate cancer survivors in Lagos, quite a prominent person in our society, Professor Okoye, said that the level of environmental pollution that exists in Lagos, that is no surprise at the consistent number of people that are coming up to say that they are down with prostate cancer. So it is important for us to create this opportunity to help Black men to better cope with prostate cancer diagnosis, make informed decisions about prostate cancer, and provide them with skills and access to care to better deal with prostate cancer, especially with abilities to understand why they need to get screened, at what age they need to get screened, and what they should do subsequently on getting screened and being given their diagnosis. Now, the iCCaRES for Black Men Science of Survivorship annual symposium is being held in faraway Florida with hubs like this, which we are conducting here today, connected virtually, scattered across Africa. The live broadcast is scheduled to begin by 8:30 a.m. EST, Eastern Time, which is equivalent to our 1:30 p.m. West African Time, which is Lagos time. But before then, we would like to engage you in a dialogue, in conversations, in brainstorming. All of us here, prostate cancer warriors, physicians, scientists, nutritionists, and advocates, on what has been our experiences in working in this ecosystem, what has been best practices for us, and what we would like to see going forward. We've made adequate preparations to cater to your comfort, and with light refreshments, tea break, and lunch. And I want to announce here that the Breaking Bad News Consortium wants to partner sustainably with this iCCaRES project. The reason for it is that a lot of times, the way the news is given to the patient or their caregivers actually define their subsequent journey through the disease process, and would like to make it better, because from all the experiences we've gathered in the 1 year in which we've been driving this process, because this May will make it exactly 1 year we started the Breaking Bad News Consortium. The more we have interactions with people living with prostate cancer, the caregivers, the healthcare providers, will be able to gather more information that will enable us to refine the way that bad news is usually communicated to the patient. Now, when I say bad news, mark you that this is just a terminology in medicine that is utilized to indicate, communicating the diagnosis of a disease process that is going to have a significant impact on the patient's lifestyle. It will impact your work, it will impact the way you eat, the way you run your life generally. And so we usually call it breaking the bad news, because a lot of people are used to their habits, and it's so difficult to get them to break it, even though it is to accommodate an ability for you to empower yourself in a manner that will leverage your lifestyle to improve your disease outcome. So as I round up, I want to tell us that we've made adequate preparations to cater to your comfort and to give you a pleasant time as we move on with this program. It breaks my heart that I can't join you in person, but I've explained to you, and I'm sure you understand the importance of my being present at this university event, including the launch of one of our counterparts directorate, because I run the UNTH Center of Excellence for a clinical trial, as well as being the initiator and founder of Breast Without Spot. All of us, UNTH, BWS, AGCPN, we are all partnering with this program of iCCaRES SOS today. And it to be indeed my pleasure to hear and get the feedbacks from this program. It is a great feat I am happy to be part of, especially about the fact that the center is currently stocked with cutting-edge equipment from the NIH, the largest funder of research globally. And when I say the center, that's the Vaccine Research Center, which the Vice Chancellor is launching today officially. So we want to thank the following partners, because you'll be asking, did this opportunity drop from the air? No, there's this amazing, outstanding, phenomenal lady from Nigeria, and she's no other than our mentor, our leader of prostate cancer Transatlantic Consortium, CAPTC, of which I am actually the coordinator for the clinical trial of the West African CAPTC. So, and her name is Professor Folakemi Odedina, the world-renowned cancer researcher. And we also want to thank her team, her great team in Mayo Clinic, that have worked tirelessly to put this together. And also all the members, different Johns Hopkins and in different locations in America, that are part of the iCare team. I also want to appreciate Dr. Amaka Lashebeko, who is another phenomenal lady, the director of the UNTH Oncology Center, who graciously granted us this venue. And I want to appreciate the management of University of Nigeria Teaching Hospital for accommodating us, always there for us, always supporting us. We really appreciate you all. Appreciate all those who are gathered here today, especially the dynamic Tobenna, who has been instrumental in ensuring that this program was put together, all the logistics and everything supported by Dr. Amaka Namani. So I want to thank us. I'm confident that you will have a very impactful session, and I believe that all is well. Before I leave, I must have to tell you that I am AKA the Pinky Prof because of all the work I've been doing in the area of cancer control for close to 40 years of my life. Here with you in this journey, and we will bring cancer to its knees. You know, I went to Roswell Park Cancer Center in Buffalo, and also visited the cancer center in Houston. And what struck me was that they are so sure that one day we will make cancer history. And this is what we want to partner with those living with the disease to ensure that we make cancer history. Welcome again to the program, and do have a lovely and most productive program. Thank you. Thank you.